Okay, let's dive into something really fascinating and maybe uh, a bit unexpected today. Think about this. Little pockets of extra fluid just showing up right inside the body's most secure zones, the brain and spinal cord.
Yeah, and they're not just sitting there quietly. They can actually, you know, cause some pretty big problems by pushing on that really sensitive nerve tissue.
Exactly. So today we're getting into canine and feline arachnoid diverticula. Now you might hear them called subarachnoid cysts sometimes.
Right, but as we'll see from the info we've got, diverticulum is, well, it's a better fit technically for what's going on.
We've got a great set of sources here, really detailed stuff about this condition in dogs and cats. It covers like everything from the nitty-gritty of what they are to how they show up in pets.
And how vets figure them out, treatment, the long-term outlook, it's at all in there.
So our mission today is to unpack all this, really get a handle on arachnoid diverticula. What are they? Why do they happen? What signs do they cause?
And how are they diagnosed? What can be done? And what's the prognosis look like? It's a chance for you to get up to speed pretty quickly on a fairly complex neuro topic.
Right. And it's striking, like you said, how these um, seemingly simple fluid buildups can cause such complicated issues in the nervous system.
It really is. And to get it, it helps to first picture those protective layers around the brain and spinal cord, the meninges.
Yeah, the meninges, 3 layers, but the one we're focused on here is that middle one, the arachnoid meter. Called that because it looks a bit web-like, right?
Exactly, like a spider web.
Yeah.
And the crucial bit is the space under that layer, the subarachnoid space. It sits right on top of the brain or spinal cord.
And that space is normally filled with CSF, cerebrospinal fluid.
Correct. CSF is super important. It's a shock absorber, brings nutrients, takes away waste, flows all around, essential stuff.
So these arachnoid diverticula, or SADs if they're on the spine,
Mhm.
they're basically weird extra pockets of that space,
Yeah.
filled with CSF where they shouldn't be.
And the sources are really specific about the name. They say diverticulum fits better than cyst because it's not a separate structure with its own lining, like a typical cyst.
Oh, okay.
Think of it more like a bulge or an outpouching of the arachnoid membrane itself. The walls are just arachnoid cells and collagen trapping that CSF.
So it's the existing structure ballooning out, not a totally new growth. Got it. That makes a difference. And where do these tend to form?
Two main spots, really. You've got intracranial ADs or IADs inside the skull. They can press on the brain.
Okay.
And the sources mention, if they're at the back of the brain in the caudal fossa, vets often call them quadrigeminal cysts.
And the other type, the spinal ones?
Yep, those are the SADs, spinal arachnoid diverticula. Compressing the spinal cord, they can pop up anywhere along the spine, neck, mid-back, lower back.
Anywhere.
Pretty much. But interestingly, the sources say they often show up in areas with more movement, like the neck and the caudal thoracic spine, sort of the end of the rib cage area.
Okay, that makes structural sense. But the big question is why? Why do these pockets even form? What makes that membrane pouch out?
Well, the sources talk about a couple of main ideas. A lot of them, especially if they show up in young animals or specific breeds, are thought to be congenital, developmental.
Generally, they're born with it.
Sort of, yeah. Maybe the arachnoid layers didn't separate quite right during development, or maybe there are these weird little fibrous strands in the space arachnoid trabeculae that mess up the normal CSF flow.
How would that cause a pocket?
The idea is that disruption traps the fluid. It can't flow normally, so it pools and pushes the membrane out, forming the diverticulum.
Okay, so sometimes it's a developmental thing.
Yeah.
But you said there's another way they can happen later in life.
Yes, exactly. The acquired or secondary type, these can develop because of other issues down the line. Things like trauma, inflammation, that's arachnoiditis, maybe infection, bleeding, or even other spinal problems, like if the vertebrae aren't stable or there's bad disc disease. And the sources specifically mention that in cats, SADs seem to be mostly secondary, often linked to some kind of trauma or irritation.
So whether it is congenital or acquired, the real issue causing the symptoms isn't the fluid itself, but the pressure it creates.
Precisely. That's the core problem. The neurological signs happen because the CSF building up in that pouch squishes the brain or spinal cord tissue next to it.
Makes sense.
And for those acquired cases, one theory mentioned is that adhesions, like little bits of scar tissue, might form. These could act like a one-way valve, letting CSF in but not easily out, causing the pressure to build.
Got it. Pressure. So what does that pressure look like? What signs might you see in a pet?
It's really variable. That's a huge takeaway from the sources.
Hmm.
Depends completely on where the diverticulum is, how big it's gotten, and, how fast it's growing.
And I saw something surprising in the sources sometimes. There are no signs at all.
Absolutely. That's really important, especially for the ones inside the head, the IADs. A lot of them are just found by chance.
How so?
A vet might do an MRI for something totally unrelated, and boom, there it is. But the animal seems perfectly fine, no symptoms linked to it, just an incidental finding.
Okay. But what if an IAD is causing trouble? What are the typical signs?
Well, it depends on the brain area being squeezed. If it's pressing on the main part, the cerebrum, the sources say seizures are the most common sign.
Seizures.
If it's back in that caudal fossa area, you might see central vestibular signs, problems with balance. Think head tilt, maybe a really wobbly walk, ataxia.
Any other brain signs?
Yeah, potentially things like behavior changes, maybe vision issues, acting dull or out of it, circling. Weakness or neck pain are apparently less common with IEDs.
Okay. What about the spinal ones, the SADs? What's the typical story there?
SADs usually cause what's called a slowly progressive myelopathy, basically spinal cord problems that creep up gradually over weeks or maybe months.
Is it painful? Like, when a dog has a bad disc?
That's one of the really interesting points from the sources, and a potential clue for vets. Pain is not usually a big, consistent feature with SADs.
Really? No pain.
Well, maybe some mild discomfort sometimes, but not that severe, acute pain you often see with other spinal things like disc herniations. That lack of major pain is a pretty significant hint.
Huh. That is interesting.
Mm-hmm.
So, progressive weakness, wobbliness, but often not very painful. What does that myelopathy look like in terms of how they move?
Usually ataxia, that uncoordinated, wobbly gait. Sometimes it's hypermetric, kind of like goose-stepping, exaggerated steps.
Okay.
And paresis, which is weakness, could be just the back legs, paraparesis, or all four, tetraparesis. And they often have proprioceptive deficits.
Meaning they don't know where their feet are.
Exactly. They might scuff their paws, stand awkwardly, knuckle over onto the tops of their feet. They lose that sense of limb position.
And the sources mentioned incontinence, too.
Yes, that's a common and, frankly, really difficult sign for owners. Urinary or fecal incontinence, or both, especially with SADs in the mid to lower back, the thoracolumbar area.
How does that show up?
The sources describe it as like dropping stool unexpectedly or wetting the bed. The animal might not seem aware it's happening. The tricky part is they might still posture normally to go, but the conscious control isn't there because of the damage to the upper motor neuron pathways in the cord.
Oh man, that sounds tough. Are certain breeds more likely to get these?
Definitely. The sources really highlight strong breed links. Pugs and French bulldogs are poster children for this, often getting those thoracolumbar SADs in middle age.
Pugs and Frenchies, okay. Any others?
Rottweilers are another key breed, but they tend to get SADs in the neck, the cervical spine, usually when they're younger adults.
Interesting difference there. And for the brain ones, the IADs.
Other small, flat-faced breeds like Pekingese and Shih Tzus seem more prone to IADs. And across the board, the sources mention a tendency for males to be affected more often than females.
What about cats? You mentioned cats earlier.
Yeah, it's thankfully pretty rare in cats. When they do get SADs, it usually looks like a chronic, symmetrical, non-painful spinal cord issue, mostly in that T3L3 segment mid-back area, and often secondary to something else, remember?
Okay, so you've got the signs, maybe that progressive nature, maybe the lack of pain in a spinal case. The vet starts thinking this might be it. How do they confirm it?
First step, always, is that detailed neurological exam.
Yeah.
That's how the vet figures out where the problem likely is in the nervous system and how bad it is. And checking that pain response or lack thereof is crucial.
Right, localization. But to actually see the diverticulum.
You absolutely need advanced imaging, and the sources are emphatic. MRI is the gold standard, no question.
Why MRI?
Because it gives amazing detail of the soft tissues. You can clearly see the fluid-filled diverticulum, which looks just like CSF on the scan, and you can see exactly how much it's squishing the spinal cord or brain. Plus, MRI helps rule out other possible causes, which is just as important. And it can show if there's also syringomyelia, that's fluid building up inside the spinal cord itself, which often happens along with SADs.
Are there alternatives if MRI isn't an option?
Well, CT with myelography is another way. Myelography means injecting dye into that subarachnoid space.
Okay.
The dye might pool weirdly or show the dilated space, sometimes like a drop shape outlining the diverticulum. but CT on its own usually isn't enough detail. MRI is definitely preferred.
And other tests.
Sometimes they'll do a CSF analysis, draw some spinal fluid, mainly to rule out inflammation or infection if things look a bit unusual. But usually with straightforward ADs, the CSF is normal. Myelography used to be more common before MRI became widely available.
Right. And given the symptoms could overlap with other things, I bet the list of what else could it be is pretty long.
Oh, for sure. The differential diagnosis list is important. For spinal cases, you're thinking IVDD, intervertebral disc disease, although remember that pain difference often helps.
Right, the pain clue.
Also, spinal tumors, degenerative myelopathy, especially in breeds like pugs, where it can even occur with an SAD infections like discospondylitis, which is usually painful, maybe even things like Chiari malformation and syringomyelia.
And for the brain.
Brain tumors, hydrocephalus, water on the brain, inflammation like encephalitis, maybe even stroke. The neuroexam and especially the MRI findings are key to sorting through that list.
Okay, so we've covered what they are, why they happen, the signs, how they're diagnosed. Let's talk treatment, what can actually be done.
The main goal, obviously, is to take the pressure off the nerves. How you do that depends on how bad the signs are, where the diverticulum is, the pet's overall health, practical stuff too.
What about just managing it with medicine? When is that the way to go?
Medical management or conservative care is usually for those incidental findings, no symptoms. Or for pets with really mild signs, maybe signs that aren't getting worse.
Or if surgery is impossible.
Exactly. If surgery is off the table for health reasons or cost or owner choice.
What does medical management involve?
Pills. Sometimes corticosteroids, like prednisone, to reduce inflammation and swelling around the nerves. That might give some temporary relief. Diuretics are sometimes mentioned to try and reduce CSF, but the sources suggest they aren't usually very effective long-term for ADs.
So mostly steroids?
Steroids and supportive care. That means strict rest, keeping activity low, maybe physical therapy, and managing incontinence, teaching owners to express the bladder, that kind of thing.
But it sounds like it doesn't fix the underlying problem.
No, it really doesn't. The sources are clear. Medical management is rarely a cure. It might slow things down, ease symptoms for a bit, but the diverticulum is still there, the pressure is still there.
Okay.
And it's worth repeating what the sources say about pugs specifically. Medical management is often actually preferred for them with SADs because surgical outcomes can sometimes be disappointing, and recurrence is a big issue in that breed.
Right, the pug issue. So surgery is for the more severe or worsening cases.
Generally, yes. If the pet has significant neurological problems or things are clearly getting worse despite medical attempts, then surgery becomes the main option.
And the goal of surgery is just drain the fluid.
Essentially, yes. Decompress the nerve tissue by letting the CSF drain out of that pocket and then trying to stop it from filling back up again.
How do they do that? For the spinal ones?
For SADs, a common surgery is a laminectomy. The surgeon removes some bone from the vertebra to get down to the dura, that tough covering over the cord.
Okay, expose the area.
Then they open the dura carefully, find the diverticulum wall, and basically make an opening in it so the fluid can drain out into the normal space. They might make several little slits, that's fenestration, or suture the edges of the opening open, which is called marsupialization.
So creating a permanent drain.
That's the idea. They'll also deal with any adhesions they find. Sometimes they use a patch, like a dura substitute, to cover the opening they made in the dura itself.
What about the brain ones, the IADs? Similar idea.
It can be with fenestration, but if it's large or in a tricky spot, they might place a shunt instead, like a cystoperitoneal shunt.
What's that?
It's a little tube that runs from the diverticulum under the skin all the way down into the belly, the peritoneal cavity. The fluid drains there, and the body just absorbs it.
Clever. And if something like spinal instability was part of the problem?
Good point. If they identify an underlying cause like that, say unstable vertebrae, they'd likely try to address that surgically at the same time. Stabilizing the spine could help prevent the diverticulum from coming back.
Okay, so they have the surgery. What happens next? What's the outcome usually like?
Well, the sources suggest most dogs do show some improvement in their neurological signs fairly soon after surgery. Getting that pressure off helps.
That's good news.
It is, but, and this is a really big but mentioned throughout the sources, recurrence is a major challenge. The signs can come back.
Oh no, why does that happen?
Could be a few reasons. The diverticulum wall might just regrow and seal itself off again. Scar tissue could form around the surgical site and cause new compression. Rarely, the spinal cord itself might even bulge out through the opening made in the dura.
So recurrence is the big worry long term.
It really is, especially with SADs and especially in those breeds like pugs that are prone to it. It significantly impacts the overall prognosis.
You mentioned physical rehab earlier. How important is that?
Oh, incredibly important. Whether they had surgery or are managed medically, physical therapy is key. It helps rebuild muscle, improve coordination, work on that proprioception, basically retraining the body.
And right after surgery, the care sounds pretty intensive.
It often is. Good nursing care is vital. Managing incontinence, making sure pain is controlled, maybe hot-cold packing the incision, and very strict rest at first, then slowly building back up with controlled exercise and gait training.
Okay, so pulling it all together, what's the long view? The prognosis for a pet with AD sounds like it really varies.
It absolutely varies. The sources stress this. So many factors play a role. Big one. Does the pet even have symptoms? If it's found by accident, prognosis is excellent, often no treatment needed.
And location matters?
Seems to, yes. Generally, spinal SADs are considered more fixable with surgery than IADs, and the outlook after surgery might be a bit better for spinal cases.
And how bad the signs were to begin with.
Makes sense, right? Pets with milder signs usually have a better shot at a good recovery than those who were severely affected before treatment. And obviously, how well the surgery actually decompressed the area matters too.
But then there's that recurrence issue again.
That's the shadow hanging over it, especially for SADs. The possibility of signs coming back definitely affects the long-term picture, particularly in those predisposed breeds where recurrence rates seem higher. If there's also significant syringomyelia, that can complicate things too.
How do vets keep track of these patients afterwards?
Regular neuro checkups are essential. Monitoring progress, watching closely for any hint of the signs returning. Owners need to know what to look for too.
And if signs do come back?
Then usually it's back for another MRI to see what's going on. Did the diverticulum reform? Is it scar tissue? Something else.
Okay. And you mentioned owner education being really emphasized in the sources. What are the absolute must-tell points for owners?
Yeah, it's critical. Vets need to clearly explain what it is, fluid pocket, not a tumor. Explain that incidental findings happen. Be upfront about the variable prognosis, especially the risk of recurrence, even if surgery goes well.
Costs too, I imagine.
Absolutely. Need to be transparent about the costs of MRI, potential neurosurgery, long-term care. Owners also need to understand they might be facing long-term management, maybe intense rehab, the specific issues for certain breeds, and that the focus always has to be on the pet's quality of life. Managing expectations is key, mentioning things like potential permanent incontinence, or that sometimes signs can even seem a bit worse right after surgery before they get better.
Wow. That is a lot for an owner to take in, probably during a really stressful time.
It is, but clear, honest information up front about the condition, the options, the potential challenges like recurrence, the costs, it's all fundamental for making informed decisions together and focusing on the pet's well-being.
So, wrapping up this deep dive, it's pretty amazing how these relatively simple-sounding fluid pockets can cause such a huge range of complex neurological issues. Really shows how delicate that whole nervous system setup is.
It really does. And looking at sources like this, you appreciate the incredible detail involved in veterinary neurology, from catching subtle signs, using advanced imaging, the tricky surgical decisions, and managing things long-term, especially with that risk of recurrence always lurking.
Yeah. It leaves you thinking, given that potential for recurrence and the different outcomes, especially for some breeds, what does focusing on quality of life really mean for a pet with a chronic condition like this, even when we have these high-tech treatments available? Something for you to mull over after our deep dive today.